everyone. I am Dr. Montinee Supchatura. I am the plastic surgeon from Department of Surgery, Queen Tilakit, National Institute of Child Health, Bangkok, Thailand, and Department of Gastroenterology, the University of Tokyo, Japan. First, thank you GIE for accepting our research for publication. I would like to introduce our research. The heading is Three-dimensional volume estimates of pancreatic fluid collection in relation to clinical outcomes of the endoscopic ultrasound guided treatment by using the data from the wonderful study group in Japan. The wonderful group is the multi-center study of the wall and pancreatic fluid collection in Japan. There are 12 centers of the wonderful study group located in Japan and start collecting data from the 2010. Aim and method. We present the technique for volume measurement by using the automatic calculation function of the synapse Vincent by Fujifilm Medical Japan. Then we evaluate the correlation coefficient between the volume and the maximum diameter and compare the volume of the collection with the clinical outcome. The result. The total number of the patients is 372. We separate into the one and pseudocystic group, and each group was divided into the subgroup by using the volumetry. Compare volume with the maximum diameter. Graph show the high correlation coefficient of the PFC1 and pseudocystic group by the R value between the 0.6 to 0.8. Compare with the clinical outcome, the one subgroup with more than 1,000 ml indicated lower rate of the clinical success and the higher rate of the mortality, significant difference. And also the Kaplan-Meier curve for the one subgroup show a low cumulative incidence of the clinical success in the group which have the greater volume than the 750 ml is significant different when comparing the time of the treatment at the 3 and the 6 months, but the pseudocystic group is not significant different. AIC EDC reveal the 3D volume and the maximum diameter are the suitable for predicting the clinical success. Conclusion. The volume was positively associated with the clinical outcome, especially the volume more than the 1,000 ml in the one group, but to the C group, the volume is not relative with the clinical outcomes. And the maximum diameter is reasonable surrogate for the volume predicting the clinical outcome, except the one with the multiple collection or the complex morphology. The 3D reconstruction reveal the correlation with the surrounding organ and the vessel, as well as the connection of the multiple collection. It is useful for the complex morphology or the navigating the EUS guided puncture. Lastly, the special thank you Dr. Nakai, Dr. Hamada, and Dr. Saito from the University of Tokyo, leader and co-leader of the wonderful study group for supporting. And thank you everyone in the wonderful study group, and thank you GIE.